Hello, Nation. I'm Jeremy Pettus. I am an endocrinologist, University of California, San Diego. Work at TCOYD with my good friend, who you might know, Dr. Steve Edelman. Thanks for coming on my show today, Steve.
Thank you for having me.
So we have a really special event today. We are going to be celebrating Steve's 50th anniversary of living with type 1 diabetes. And for those of you who don't know me, I've also had type 1 since I was the age of 15, but today it's all about Steve and his 50-year journey. And we thought it would be fun to kind of interview him. So I wrote down some questions about, his life over the last 50 years, which he has not seen. And we're just going to kind of go through them. So anything you want to say before we get started?
I would say thank you for acknowledging that. And before I say anything else, I think I'm going to wait for the questions.
Okay.
Thank you for joining today.
He was making fun of me of all my notes, but you probably can't see them. But I'm taking this seriously. So let's just start, Steve, with your kind of diagnosis story. So you're 15. Walk us through how that happened, your symptoms, and how you found out you had type 1.
Yeah, I was 15. I was losing weight. I was thirsty. I was urinating a lot. And I was kind of a chubby kid. So my friends used to call me the stump. And I kind of liked it. I was fitting into my sister's jeans. And I remember clearly I was in middle school, Patrick Henry Junior High, and I would go, every class was an hour. I'd go to class about 20 minutes through. I'd have to ask the teachers, go to the restroom.
You were in junior high when you were 15? You failed a couple grades?
Back in San Diego, in Los Angeles, you went to the equivalent of 10th grade of high school.
Okay. We're going to fact check that.
And I go to the restroom and drink at the water fountain forever. And then I come back, and about 20 minutes later, I have to do it again. Teacher, was giving me serious grief. And I just was thirsty and urinating a lot. And one day I just said to my mom, I said, hey, I'm not feeling good. So she took me to the hospital. I went and saw my doctor, and next thing I know, all hell breaks loose, and they threw out a wheelchair. They took me to the ICU, and I'm going, well, gee, I can walk. They said, no, sit down. And I was in the ICU for 4 or 5 days, ketoacidosis. And the one thing I remember about that hospitalization was the nurse came in one day and gave me a huge bolus of insulin. It was like this much in a big syringe.
This is IV still, or this was in your stomach? Or?
This was subcu. And then the doctor came in on rounds, and I said to him, how come they gave me so much more insulin than yesterday? And he said, no, they shouldn't have. So the nurse mistook 15U and 150.
So they thought the U was a 0.
Yeah.
So you got 150 units.
And all hell broke loose again.
Oh, my God.
IVs and people crashing, and I was fine. But the other thing I remember going to diabetes classes.
Well, hold on. So you were fine after 150 units? I mean, you don't remember what they did.
Yeah.
They pumping sugar in you.
Yeah, IVs.
Jeez Louise.
Yeah, 2 IVs. And, I don't have the hospital records. I asked my mom just the other day on the phone, because she's quarantined, if she had the records. It was like June 10th.
Okay.
1970. And so anyway, I went to class while I was in the hospital, and there was a room of 40 very, I would say, overweight people with type 2. The endocrinologist giving the class was overweight. He was smoking. And I was sitting there, and I always talk about this. I used to talk about it. I said, the only thing I remember from this class is ketchup has a lot of sugar.
So you don't fit in. You're the only.
Oh yeah. Are you kidding me? I was like the only type 1 there.
So all the education was type 2 centric?
Yeah.
Okay.
And I was pretty skinny back then, and I was trying to think, gee, I don't know if I could lose any more weight. That's all they were talking about, losing weight.
Oh my gosh. So then do you remember kind of what your thought process was at this time? I mean, you're 15. Are you thinking, I just want to get out of the hospital and get on my life? Or are you thinking complications? Are you thinking
I wasn't thinking any of that.
Yeah.
I mean, I really wish I thought about it more, to be honest. I didn't know what diabetes was. I never heard of it. And I was on 1 shot a day, NPH in regular morning. I was urine testing, and I also had the little pills for glucose and acetone. And I'll tell you what, I really had no clue, and I don't remember having any deep thoughts about diabetes and complications. There was a nurse when I was in the hospital kept saying to me, you could live a long life. You could live a long and healthy life. And she said, like, and I finally said to myself, why is she telling me this?
Why wouldn't I?
And then I got a little bit worried because, like, why?
Yeah.
And that was the only thing that was related to complications.
Okay.
My doctor at the time never really said anything.
Wow. And then you mentioned a little bit, but what was your initial regimen? What were you sent home to do?
Oh, easy. NPH and regular, mix it together once in the morning. And then I did my urine testing, supposed to, 4 times a day. I had the little chemistry set. Can't remember when the glucose strips came around, but that made it a little bit easier. And, as you know, what was in your urine at time X, might have been in your blood minus a couple hours. And, of course, I didn't do it that much.
So all night long, you're probably 300-400. Were you still peeing a lot?
You know what? On and off.
Yeah.
Because as you know, NPH really doesn't last that long. And that's what I was on for several years. And I know my glucose was out of control. Yeah. Now, it wasn't, who knows if I was in mild ketoacidosis, but it kept me, I never missed a shot. And I was sent home on the exchange system. My mother would weigh the food and things like that. And I was pretty much independent. I was thinking about this morning driving in here today, and my mom, she was really worried, a great mother. And, I was pretty much learned to do it on my own. And my father, he never accepted that I got diabetes, never helped. He never mentioned it. And I think, thinking back, I think he was scared to death of it. Mm-hmm. He was just frozen and didn't say a thing.
Yeah. What about friends? Like when you went back to school,
Yeah, you know what? I didn't really. I was kind of in the closet.
Yeah.
And I did have one friend named Mike Anderson. Can't believe I remember that name. He had type 1. And one thing I remember about him, he had a really kind of a puffy face, and he was beet red all the time. Maybe he was in a tanning booth. I don't know. But that's one thing I remember about him. And I always wonder, today, I wonder how he's doing. Mm. If he's still alive, is he blind? Is he on dialysis? So
this was a friend you had before, or you became friends with him?
Became friends with him.
Yeah. And that helped, kind of?
I don't think it hurt, but I don't remember any. I don't really think of it very much.
Got it.
So, I was pretty much, I didn't tell anybody either.
And at this time, around when you're diagnosed, what did Steve Edelman want to do when he grew up? Did you already want to be a doctor, or was this something that started getting in your head?
Yeah. Well, I wanted to be a dentist. Because the dentist always had a chest full of toys. And when I left, kind of like your son, Cooper, then when I got diabetes, I said, well, I want to be a diabetes doctor.
That day or that?
No, a little bit later.
Okay.
A little bit later. And I can't tell you exactly when, but I think when I was in high school, before I went to UCLA undergrad. And so I just said at that time, I'd like to be a diabetes specialist. Yeah. And and that's focused everything after that.
Right. So then high school, college, med school, we'll talk about those a little individually. But do you remember any major changes in your diabetes regimen? Like when did you go from 1 shot a day to the next thing?
Yeah, believe it or not, I went to high school. I played high school football. My control was probably not that good. But to this day, I've never been admitted to the hospital for ketoacidosis, although I probably was in mild, and I've never passed out from hypoglycemia. So I've come close. Yeah. But high school, I played football, and I took my 1 shot a day. And then when I went to UCLA undergrad, I hung out with these 2 great diabetes specialists, Mayor Davidson and Richard Berkson. I volunteered to work in their lab so I can apply to med school. It would look good on there. And they became lifelong friends. And at that time, they let me hang out in the UCLA diabetes clinic. And at that time, I started on multiple daily injections. So I was NPH twice a day, and then fast acting twice a day, and then 3 times a day. And then, of course, in 1981, that's in medical school, believe it or not, that's when the glucose strips first came out.
Okay.
So I didn't even have those as an undergrad.
So that was 1981. So you had diabetes 11 years.
Yeah. And I graduated UCLA in 1977. And so I was still urine testing, mostly on the little dipsticks. And to think about trying to manage your diabetes, how to give extra insulin.
So what was that like when you saw your first blood sugar result? Do you remember that? Was that a big deal, or was that just...
Yeah, well, you know what? It was a big deal. I worked at a camp called Camp Kybers with Dr. Shakola Slam. It was UC Davis.
He was my endo when I was diagnosed. It was just a small world. Yeah.
Jeremy's grew up in Sacramento, and that's where Davis Medical School is. And he was a crazy guy, and he said pricking your finger could cause cancer later in life. But it was the old Accu-Check Behring or Mannheim strips that you held up. We were so good at estimating your blood sugar based on the color chart. Yeah, it was amazing. It was absolutely amazing. And I think that's the first time I really started to adjust my insulin.
Yeah.
Used to do it 8 to 12 times a day. And I'm sure, I was thinking about this earlier too, that if they measure time and range and glucose variability and standard deviation, mine must have sucked. That's it, man.
Yeah. It's still way better than, when you started, one regular and NPH.
Yeah,
I just can't imagine.
And, and by the way, I switched to the longer acting basal lente and ultra lente. Wasn't that stable on a day-to-day basis, but predictable, I should say, but it was way better than NPH.
And then, so you're in medical school now, and you're learning a lot more about diabetes, how pathophysiology, all that. And then, so I was just thinking about how you must have this parallel kind of thought process where you're learning more about yourself, but you're also learning how you want to start helping people. And how did that kind of evolve? Was that something that as you learn more about diabetes, you felt like you were better equipped to maybe down the road start something like TCOYD? Like, do you remember that brewing in you?
Yeah. Well, a couple of things happened in medical school. I try to make it brief. That I remember the class on diabetes. I'll never forget it, where the professor, was throwing statistics up, and he said 50% of all people with type 1 are dead or on renal failure 20 years after the diagnosis. So for me, it was about 12 years.
You were 12 years in.
Yeah.
So you had 8 more years before you were either dead or
I was 15 when I got it. And then it was like, medical school, young 20s. I remember turning 21 in medical school too. And I remember everybody in the class kind of looking over at me. It was a big open classroom. And I was just sitting there, and I could see them all looking at me, trying not to look around. And
did you feel like that applied to you?
Well, you know what? The unfortunate thing was my cadaver in medical school. For those of you that haven't gone to medical school yet, you have a cadaver, someone donates their body, and you have like 4 people assigned, and you dissect the body. But no, my cadaver was a type 1. He was 27, died of renal failure. And the one thing I remember about him, he was fit, and he was young. And I'd say, that had an effect on me. And I said to myself, gosh.
Oh, that's just awful. Of all the cadavers, you get the young type 1. So you must have been 27 at that time.
I was younger.
26, 25.
No, I wasn't even that old. I turned 21 in medical school.
Really?
Yeah. Childhood genius.
So you failed out a couple of grades early in medical school, and then you caught up.
No. I don't forget. I went to medical school 1 year later.
Okay.
Because I got a master's in endocrinology.
Well, so this guy's about your age.
Yeah.
So you unzip this bag, and there's a type 1 diabetic. Jeez, Louise.
Yeah. You think someone would have said, "Hey, let's have Steve do that, do something else." But then I would just say this in answer to your question. I started seeing patients in the clinical rotations with diabetes, and then I felt kind of like I told them that I had diabetes, and I think at that point it hit me that, gosh, this patient really appreciated the fact that I shared I had type 1. I could empathize with pricking your finger and giving injections and highs and lows and hypos when you don't want them. And at that time, you didn't have any, there wasn't any, I would say, ease of taking tests, and, and they didn't have anybody help you at all. So you had to bring your glucose tabs in, and it was kind of a crapshoot if you got low during the test or not. I don't remember ever having a huge problem, but it was just, worried about even taking the national boards, part 1, part 2, part 3. It was just like no accommodation. That's what I'm looking for.
And when you're seeing patients in clinic, type 1s, type 2s, did you have different mindsets approached with type 1s or type 2s, or you just got along with all of them?
Unlike other people, I would just say this, that it was type 2 was like a regular patient, but you can still empathize. Those people had to test and stuff like that, but they didn't have to. Their big issue was lifestyle. And we didn't have much choices back then for people with type 2. So the type 1s I really bonded with and I could really relate to. And I said to myself, gosh, there's got to be a better way to treat these folks, a better way to educate them. Because I kept thinking back to my days when I was diagnosed.
Yeah.
They just put everybody together.
Yeah.
Yeah, it was, so I think in medical school, I really said, okay, this is your calling, you know?
And I don't think I've ever asked you this, but did you ever think about going the pediatric route then?
No.
No.
No, because I was so much of a kid myself. I needed to hang out with adults. So no, I didn't. I really didn't. Now that you asked me.
Yeah.
Yeah, you know, I just went into, did my master's. I got a master's in endocrinology, and then I went straight from the master's degree to medical school at UC Davis. Yeah. Yeah,
I didn't either. I don't really know why, but it was always adult medicine for me. But all right, so I'm going to come back to some of the kind of your complication story, but a little bit on TCOYD. So, you know, kind of jumping around, but medical school, residency, you go through your training, you come on faculty, you know, as an endocrinologist. And how did this idea of TCOYD develop? What's the origin story of TCOYD?
Yeah, that is very clear cut to me. You know, there was, as you know, there was this very large study called the Diabetes Controlled Complications Trial. It was like a $150 million study. It was set to be 9 years. It was, the main purpose was to determine if getting your glucose as close to normal as possible can prevent the onset and delay the progression of microvascular complications, eye, kidney, and nerves. And believe it or not, at that time, there were doctors who let their patients go completely sweet, blood sugars high, because this study was not done. Even though many studies in Europe and other studies show, yeah, if you go to the hassles of controlling the blood sugars, you can really help someone avoid these complications. And so the study was done. 1993, they released the results in the Las Vegas Convention Center with the American Diabetes Association. And I remember that I was there. In fact, I've been to every ADA since 1987. Never missed one, this year virtually. So then I thought, okay, finally, for some of these deadbeat caregivers, they're going to really start controlling their patients. And it didn't happen.
Yeah.
The people that didn't believe about tight control in the beginning, they didn't change. And I said, okay, something has to change. So that's when I had the idea of TCOYD.
I think for somebody like me and people more, you know, recently diagnosed, I was diagnosed in 94 after this publication. And to me, it was always the way it was. You control your blood sugars and you do better. And it's hard for me to imagine a time when that wasn't known. So what Steve is saying is that it used to be just, you know, people be 200-300, and as long as you weren't hypo, then you're doing great. And then the studies finally published in 93 when, you know, he wanted something to change.
Yeah, well, you went to an endocrinologist. I went to an oncologist, because when I was admitted to the hospital for DKA back when I was 15, they took turns taking whoever was admitted you, they took you on as their regular patient. And
so he knows nothing about diabetes.
Yeah, and could I tell the donut story?
Yeah.
Real quickly. Every time I saw this doctor, Dr. Brett, Alan B. Brett, and he would always have a clipboard. He'd come in, I'd turn in my urine, they'd draw my blood in the lab because he didn't have it at home. And I knew my control was terrible. And he'd always say the same thing to me: Steve, you're doing fine. I'll see you next time. And I'm not exaggerating this.
So this is, by the way, no A1C.
Right.
So basically you would just pee in a cup and they know what your blood sugar was.
They drew my blood that day because it was a hospital.
They knew what, for that minute, what your blood sugar was. That's it.
Yeah. And I knew it was high. And so by the time a couple years later, I had my driver's license, I went to Winchell's Donuts. I bought, and I love donuts. Maybe this is why. I ate five donuts. 5. You know, when you're a teenager, you can eat 5 donuts.
Were you eating them like angrily?
No. I enjoyed every bite. Maple buttermilk bar was my favorite. And so I ate them all.
Well, hold on. In the car? I want to visualize this.
You know what? I can't remember where I ate them, but I think those must have been in the car. You know, Winchell's Donuts is like, like a fast donut place. And I don't remember where I ate them. Yeah. And I went in, maybe half an hour later, maybe an hour later, they drew my blood, they took my urine, and I was waiting for him to come in and say something to me. And I
must have been 400 or 500.
Oh, I was, because I had my own glucose strips with me. I went into the bathroom and it turned black.
Urine strip.
Yeah.
Yeah.
And that, when it turns black in about 5 seconds, you're like really high. So he comes in the room and he had a clipboard and he looks at me and he goes, Steve, He goes, "You're doing fine. I'll see you next time." And I never went back to see him again. About every 5 years, I'd look up.
Because you knew I'm not doing fine.
Oh, I knew I wasn't. And I knew he wasn't doing anything to help me. So at that point, I never went back to see him again. And I eventually, as I told you, went to UCLA, and I hung out with a couple really good diabetes specialists. But back then, I realized that I really was in bad control for a long time.
So we were talking about TCOYD.
Yeah.
So I guess this is the backdrop. But that was kind of the standard. And then finally we have proof that controlling your blood sugars matter, but things aren't changing. So you want to do something about it.
Yeah. And then I decided that let's take the important messages about living a long and healthy life with diabetes directly to the people most affected. And that was the beginning of TCOYD in 1995, 2 years after the release of those results. And then it's been 25 years now running TCOYD.
And tell me how that got started. I mean, you're working full time at UCSD, and how did you get it off the ground?
Yeah, I was just like you. I was working full time at UCSD in the VA, and I went to a woman named Sandy Bordet who worked for a pharmaceutical company, and I did a lot of lectures for her, doctors. I think it was like hypertension. And I said to her one day, I said, I want to put on a conference for 1,000 people at the San Diego Convention Center. I want to call it Taking Control of Your Diabetes. And she helped me get the first one going. I got sponsorship, I got funding, and we had close to 800 people at the very first TCOYD. And we've been back to the convention center every year since 1995. And this year, we're still deciding, but it looks like it's going to be virtual for the rest of the year. And then we started going to other cities. And I was just going to do it once a year. It was a lot of work. I had my day job. I had 2 young daughters. And then it was just...
Tell me what was your, so you have this vision, you put on this first conference, 800 people come. Do you remember your emotions around that event?
Yeah. It's amazing. It just struck me that people with diabetes really want information about to live a long and healthy life. I always say they're extremely thirsty for information. And, that's kind of a funny word because you're thirsty when you're out of control. But that day was amazing. And I'll tell you what, almost every conference I go to, I still get that feeling like people really need help.
Yeah. And did people come up and talk to you or thank you at the conference?
Yeah, I mean, it's like amazing. They're so happy and gratified and just appreciative. And I still remember one lady comes up, sorry, it's COVID, she said, I just want to touch you. And I said, well, don't worry about that. Let's just talk,
Yeah. Well,
just people are desperate out there for information, some more than others. And there's a lot of people with complications out there too. And even to this day, not everyone has access to the best care, the best doctors. You see it yourself.
So 25 years now, TCOYD. And, I don't know if people really understand this, but the number of conferences that you've done, I mean, we do probably on average 8 to 10 conferences a year. So once a month, we're flying to some city and it's this big to do. So it's been how many hundreds of cities and conferences and people reached. And I've asked you this before, but it's a disruption to your life getting on that plane. And what keeps you going? When you're going to the airport, get on that plane to go to Omaha, to go to Kansas City, to go to wherever.
Hawaii. Hey, they need help.
I wasn't trying to list bad places. These are all just places that we've been. What keeps you going?
Yeah, I think what keeps me going is the day of the event. Working with all the great folks at TCOYD, you can see some of their pictures up here, and meeting people, other speakers, people, caregivers with diabetes. The day of the event reminds me why I do it. And yeah, it's a labor of love. Over 200 national conferences in like 70 cities. And even though we can't hit everybody, we try to get people with diabetes, their loved ones, and we try to get them to spread the love and spread the information. And the day of the event really reminds me why I do it. And, my kids have been super supportive, but think about this. It's, if there's, how many weekends in a year 30, something like that. And, you know, with over 200 conferences, that's like 4 years in a row of every weekend being gone. I've dragged my kids and my family to them many times. And so, yeah.
What do you know, so you did the first one in 94?
1995.
Okay.
September.
A little over 25 years now. We had the 25th last year. How has that conference changed? I mean, obviously there's different things going on in diabetes, and maybe there's more people at the conference and more options. But what about the feeling in the room, the emotions? Is that the same? Are people more hopeful, less hopeful? How do you see diabetes in that time?
Yeah, that's a good question, Jeremy. When I look back, I still have the 35 millimeter slides. Remember those? With the slide projector and the carousel, and you drop it right before your talk, and the bulb goes out in the projector. You know, the basic structure of that very first TCOYD is not that different than today. Now we have a type 1 track, type 2 track. We brought in the healthcare professionals who do a parallel continuing medical education track. But the basic structure is the same. And so when I look at it, yeah, the information is much different. And man, we've come a long way. I mean, oh my gosh, the therapies are so much better for both type 1s and type 2s. The devices, now type 1s and type 2s share medications, technologies, but the basic structure is the same. Education and motivation, and getting people to put diabetes higher in their priority list. And, you know, we still have people that need a lot of help, and to get access to these. So in a way, it's similar, but the information is so much greater, and the hope is so much greater.
If you guys haven't been to a conference, you know, I remember mine first one vividly. Tampa, you know, 2010 or something. I was just blown away. I mean, the information, but I think, you know, the camaraderie, you know, just being amongst people that, you know, care about people with diabetes, or just, you know, are living it themselves. It was pretty emotional. So this is, I think, my last question about TCOYD, but, you know, in this span of time you've had with TCOYD, is there a moment, you know, or something that sticks out as your biggest point of joy or pride with the organization?
Well, Jeremy, you know, I mean, you know, not knowing what you were going to ask me, I would say that there's really not one thing. It's, you know, the 25 years, you know, has gone by pretty quickly, very slowly at times, between all the flights and the hassles and dealing with all the infrastructure of TCOYD. I would just say it's been an awesome experience that, you know, you cannot put a price tag on. And it's the whole gestalt of helping people, needy people, addressing people of all socioeconomic classes, because we know that diabetes crosses all those boundaries as well. Putting on conferences for Latinos only, focusing in on African American cities, Pacific Islanders, writing the TCOYD book in Spanish, giving Spanish-only lectures. I think the joy of helping people, and that's kept me going. And once again, working with a great group of dedicated folks at TCOYD, you know, and yourself and other people like Tricia Santos and our executive director now, Michelle Feinstein. It's been you cannot put a price tag on that.
Yeah.
You know?
Well, anybody that knows you knows that you love what you do.
Yeah. Yeah.
So we'll leave TCOYD for a second, and we're coming back to you for a little bit, and just some kind of, not like a lightning round, but a little bit. So over the last 50 years, what has helped you the most in terms of your type 1 diabetes management? It doesn't have to be a physical thing like a new pump or whatever, an approach, a thought process. What has evolved over 50 years with type 1 that's helped you?
Well, you know, hanging out with other friends like yourself, who not only are endocrinologists, but sharing ideas. I mean, you know, getting on CGM, getting on looping, getting on the hybrid closed loop, the TAMP control IQ, and just getting motivated, you know, to get the diabetes under control, and that makes you feel the best. So it's really using the technology, but I would say more important than that, talking to friends and getting their experience as well. You know, competing, who has the best time in range. That's we're in the middle of a contest, and doing fun stuff like that, I think, is helpful.
Yeah.
Exercise is key too.
I mean, it's kind of interesting hearing, you know, when you started just urine testing and one shot of regular NPH, horrible control, but you probably didn't think that much about diabetes or really interact with it too much. And now you have all these, you know, gizmos that really help you get control. So I was going to ask you if it's gotten easier, but that might not be the best question. It's just, do you feel healthier? Do you feel?
Yeah. Well, you know, Jeremy, I'm not sure if you were to ask me, but, you know, I do have my list of complications. Yeah. And, you know, being a diabetes specialist, going to tons of meetings and listening to what you're going to pass away from, what percent get retinopathy, 1% get, you know, going to those meetings as a medical professional, I did a pretty good job of just separating them out and, you know, like not thinking about myself too much, but, you know, developing complications, dealing with them, you know, fear of going on dialysis.
So that was kind of the next thing I want to talk about, because I think that's important. So when was your first complication?
Yeah. Medical school, I had blurry vision one day, and I don't know if it has anything to do with it. My good friend John Thomason, after a softball game, gave me a big bear hug. He's a rugby player. And then I had blurry vision the next day, and I went and saw a diabetes eye doctor in Sacramento, Dr. Peacock, I believe his name is, or Peabody. And he said I had some beginnings of retinopathy and had a little bit of edema. And so that was the first time. It was, and then when I was doing my fellowship at the Joslin Clinic, I had a vitreous hemorrhage in my left eye. I lost vision in my left eye, pretty much like 80% gone for about 3 or 4 months until the blood settled. So, you know, it was a wake-up call for sure. And I realized, so that was basically 12 years after getting type 1, you know, with bad control. It's not unusual. So at that point, you know, I started to worry.
And did you think that this is just the way it went, or there was something you could do about it, or?
I both.
Yeah.
Both. And I remember my first job as an endocrinologist, I did leave San Diego for a while. I went to Portland, Oregon, and I turned in my urine for a life insurance. And they told me there was a ton of protein in there. So that was another wake-up call. And that was after my fellowship at UCSD and the Joslin. And then I came back to UCSD to join faculty with Dr. Henry.
Mm-hmm.
So I had, you know, retinopathy, and I had protein in my urine, and but I still had good vision and kidney function at that time. So you know, it's like anybody else. You sort of don't think it's going to happen to you. And my control still wasn't that great back then. It was a lot better, but you know, if I had an A1C less than 7.5, it was like woohoo.
Yeah. Well, looking back, I mean, do you have any guilt? Do you feel like this was your fault that you got complications, or do you feel like you just, that the timing, that's just the way it went?
You know what? I don't really have any guilt, but I sort of wish that I could have slapped myself and been a little bit more on top of things. Yeah, no, I don't blame myself at all. I kind of think it's unfortunate that I got diabetes at the time. I didn't have a diabetes specialist that really said, hey, Steve, you know, like Dr. Shakolswan with you. But at the same time, I feel fortunate that I ran into, once again, Dr. Berkson and Mayor Davidson at UCLA when I was an undergrad. And I think that was a really crucial time that I started to have much better control right before the complications became end stage.
Yeah.
So, you know, you can always slow them down and kind of halt them if you jump on things, you know, and then it was blood pressure and protein intake and all that kind of stuff. But I think I feared going on dialysis more than anything else.
Yeah.
Because we did have laser therapies for the eyes, and we now have injectables. We can really stop retinopathy, but with kidney, you can't inject anything in your kidneys. You don't have laser to your kidneys. Right. So,
and then this is something that you've kind of talked a little bit about before, but you know, you're dealing with all these complications, and you know, you're seeing lots of patients with diabetes, and do you feel conflicted telling them that you have all these complications, that you're worried that they're going to say, well, what does this guy know? That, he's teaching me how to take care of my diabetes, but he's dealing with all these complications? Or do you feel like that just makes your story more real? Or how do you deal with that?
Who said I told them I had complications?
So you usually don't, but I wonder why.
Well, I do if they have them.
Okay.
But I don't want to scare people who don't have any. Yeah, so it's you got to know your audience. And I would say I don't really share it that much. A couple years ago, you pushed me to write an article about it. And once I did, I felt that was good, that I shouldn't be embarrassed. Because, you get people at conferences and they stand up and they say, I've had diabetes, 40, 50 years, and I don't have any complications. That makes me feel bad.
Yeah.
And I know they're not doing it to, make anybody feel bad. But, it's like you're a good person if you don't have complications. Right. And you're a bad diabetic if you do. So, and I realize they don't mean anything by it, but it does, sometimes it's a little insensitive.
Yeah. Well, I know, you've had to go through the laser therapy on your eyes and injections in your eyes, which you sent me pictures of. Thank you. And, I know
looking for sympathy, come on.
You're worried about your kidneys, but they're hanging in there. And you mentioned some musculoskeletal stuff, but I mean, so what's your attitude now around diabetes?
You know what? I feel like if you ever watch the Terminator movie, and he keeps coming back. They pull off his legs, this and that, and he's still coming back. And I feel like, I'm pretty much a textbook, and I can go through the big laundry list. But I feel like what's the alternative? To just do my best to keep fighting and go to seek out the best care. And as long as I can help people, hey, it's all good. And, I have a pretty good attitude about it. I get that from my mother. She's got a great attitude on life. And I think it's just, I was born with that. So I feel fortunate. And just do the best I can and deal with the complications and support from friends like you.
Yeah. All right. A couple more questions.
Man, come on, man. This is like a 3-hour
documentary. Okay, almost done. What's your favorite thing to eat when you get low?
Peanut butter. And I know it's not the best, but a little bunch of grape jelly on top, in the sandwich. So good. Tons of milk. As I'm finishing the last half of my quart of milk, I'm getting out my pump or injection to give myself insulin so I don't end up at 400.
I know. We talk about this time. The peanut butter is the worst thing you can eat when you're low.
If there were donuts in the house, which there usually isn't, I did get low last night, and I had a leftover donut. It was so good.
You're right. The best is when you're eating 3 a.m. and you're just injecting insulin because you don't care.
Yeah.
Keep eating.
I also like tricks. Cold cereal.
Yeah.
I could eat bowl after bowl,
So with that in mind, what's the biggest positive from having type 1 diabetes?
I have a focus on my career, and I could, where I didn't have to think, what are you going to do when you grow up? And there's a lot of gratification helping people with diabetes. That's the quick answer.
All right. These last 2 questions are on the same theme. So you could go back and talk to 15-year-old you in the hospital, sitting there just diagnosed. What would you tell him?
Well, I would certainly know how to speak to him and say, listen, you got a chronic condition. We don't have any cure. We have great ways to treat it, and you can do anything you want in life, and don't let anybody tell you anything different.
All right, now I'm going to flip it around. So 15-year-old you could be here. What would he think of your life?
Say it again.
If 15-year-old you could see you now,
yeah,
what would he think of all that you've done?
I think he would say, man, that's pretty cool. I want to be just like you, except do a couple things different. And so, yeah, that's a good question. Well, I've helped a lot of teenagers through the years, not as their official doctor because I'm not pediatric. And, I really want to be their mentor and sit down and say, hey, you should do something relating to diabetes, if it really excites you. And you can avoid a lot of the complications that I have because you got a head start. And so, yeah, it's trying to motivate people that, hey, don't let diabetes slow you down.
Yeah. Well, I think you got away from the question a little bit, but I think you'd be incredibly proud of everything you've done. So, can I give you a hug?
Thank you.
Love you, buddy. Love you too, man. All right. Got her midriffs there.
COVID.